Well, Mr. Bacco, after looking over all your charts, I'm sorry to tell you this, but I've never seen pulmonary arterial hypertension this bad before.
What do you mean I have preliminary arterial hypertension? My blood pressure's fine.
Actually, sir, it's definitely not. In fact, your pulmonary veins are probably stiffer than that swisher.
On a scale of 1 to 10, how ready do you think you are to quit smoking?
On a scale of 1 to 10, how sure are you that I have to quit smoking? What do you think you are, some sort of doctor?
I do, actually. Put that readiness ruler away. We'll address that some other time.
Fine.
Anyway, sir, it looks like you've been experiencing pulmonary arterial hypertension for 3 years before this most recent hospitalization. Have you done anything for management in the past?
Well, my doctor gave me some medications to take for it, but I never took any of those. And he told me diet and exercise too, so I just figured I'd go down to the McDonald's on Forbes every day for diet and exercise at the same time. But, today was my last day of work before retirement, so I'm just looking forward to the rest of my life with my family.
Dr. Weber Yeckerman Jensen, I have some information on some options you might want to hear about.
All right, let's step outside. Do not light that in here. All right, so this is probably the single worst case of PAHD I've seen in all my years here. Do you have any idea what his options are?
Well, I don't really know too much about PAHD. It's not something that I learned back in cardio in school.
Don't worry, you'll learn about it next week. It's a narrowing of the pulmonary arteries, which leads to procoagulation states, platelet activation, and remodeling of the vasculature. The patient's right side of the heart doesn't receive enough oxygen, so the patient can end up in heart failure and heart dysfunction.
That sounds horrible.
7-year survival rate after diagnosis is only about 49%, and he's already in group 3 severity. He's probably not going to make it till his next Christmas. Those poor kids.
Do any of you white coats have a lighter? This swisher isn't going to smoke itself.
Well, I heard about this new drug called Selexipag on a commercial last night. Selexipag is indicated for arterial pulmonary hypertension. It's also known as Uptravi. It's a selective non-prostanoid IP receptor agonist. IP receptors are prostacyclin receptors, which induce vasodilation.
Interesting. Can you tell me more about it? Does it improve outcomes in patients?
Well, in the Griffin trial that was conducted in 2015, outcomes were improved to some degree with Selexipag over the placebo. The risk of hospitalization and disease progression as primary endpoints were significantly lowered, although a primary endpoint of death was not significantly different with Selexipag over the placebo.
So it sounds like patients have a better quality of life when they're on Selexipag than placebo.
My quality of life would be a lot better if I could just smoke.
Anyway, what are the pharmacokinetic parameters?
Anyways, we have to be aware of the other drugs the patient is on. Selexipag is metabolized in the liver and is absolutely contraindicated with the CYP2C8 inhibitors, such as gemfibrozil. And we also need to watch out for when the patient is on this drug with trimethoprim. Also, Selexipag has a low volume of distribution, around 12 liters, protein binding of 99%, which makes the active metabolite have a longer half-life of around 6 to 13 hours. Its oral bioavailability is approximately 49%, and it reaches its Tmax in 1 to 3 hours.
All right, I think I've heard enough to make a decision. Let's get back in there with the patient and start discussing initiating therapy.
Doctor,
What?
I miss you. I miss the way we used to be. Remember that night in Tallapee?
It was one time. What about Lorenzo, huh? He wasn't even dead for a week.
You have no idea what we shared. We may have only been married for 12 days, but I loved that man. We have a patient to take care of. We'll talk about this later.
Editor.
The Young and the Breathless will return after these messages. Are you tired of your loved ones dying from pulmonary arterial hypertension? Introducing treprostinil, a recently approved drug that's shown to improve quality of life in patients with pulmonary arterial hypertension. Treprostinil is a prostacyclin vasodilator that has been shown to improve quality of life, mainly through increasing 6-minute walk time versus placebo. Oral treprostinil does not yet have strong clinical trial evidence supporting its use. Oral treprostinil inhibits platelet aggregation and may increase the risk of serious bleeding. No absolute contraindications for treprostinil have been established, but talk to your pharmacist to make sure treprostinil will fit into your medication regimen. Oral treprostinil has a Tmax of 4 to 6 hours, is 96% protein bound, has a half-life of 3 hours, and is extensively metabolized by the liver enzymes CYP2C8 and CYP2C9.
I don't even know what that means.
Treprostinil has few observed side effects, including diarrhea, nausea, headache, systemic hypotension, edema, jaw pain, cough, loss of appetite, syncope, vasodilation, gastrointestinal hemorrhage, pneumonia, cellulitis, sepsis, and dizziness. Talk to your doctor if you are renally or hepatically impaired, as treprostinil may not be right for you. Do not take treprostinil if you have an allergy to treprostinil. Abrupt discontinuation of treprostinil may lead to exacerbation of pulmonary arterial hypertension. Treprostinil, for when Selexipag just isn't an option. We now return to The Young and the Breathless.
All right, Mr. Bacco, after some consultation with my pharmacist here, we've decided to start you on a new drug therapy called Selexipag.
Hey, I actually just saw a commercial about that drug a few days ago. It seemed pretty awful, but I could use a little help with my jump shot.
No, that was treprostinil. Don't worry, with Selexipag, it ensures you only die 51% of the time.
Wow, what great odds. I feel so much better.
All right, Mr. Bacco, based on your condition, your starting dose is going to be... Hey, you're the pharmacist. What's the starting dose?
I don't know. We haven't learned about that yet. Anyone want to help me out and win a Dunkin' Donuts gift card? Oh, right. It's 200 micrograms twice a day, titrated up weekly to a max of 1,600 micrograms a day.
Okay, sir, so with this new medication, there are some important things we have to go over. First, make sure you always take it with food.
Okay, so what kind of food are you talking about? I have two options. I could go to the Peterson Event Center for lunch, or I have some mean mystery meat left over from last week's dinner.
Doesn't matter, whatever you prefer. I also recommend that you report any signs of bleeding.
What do you mean, any signs of bleeding? Do I look like I know how to speak sign language? How the heck am I supposed to know if I see the sign for it?
No, not bleeding signs like that. I mean, if you notice any blood in your stools or while you're brushing your teeth. It's also important to keep in mind that if you do miss a dose, that you take it as soon as possible. And if you miss 2 doses, you will probably want to contact your PCP.
Oh, okay, sounds good. So I'm going to report all these signs to my PCP. I'm actually a PCP free agent right now. I used to see Dr. Quarter Pounder with cheese, but he retired, so I have my first appointment with Dr. Pepper next week.
Okay. One last thing to remember is that you don't want to abruptly discontinue this medication. It can exacerbate your effects of pulmonary arterial hypertension.
Hey, Whitecoat, I have a question.
Yeah, what?
Who the heck do you think's gonna pay for all of this? These swishers are a lot cheaper than your fancy little lung drug.
Well, sir, we do know that Selexipag is very expensive. In fact, this whole hospital stay might be costing you your entire savings account. Luckily, we did hire a new member of our team recently. He's a copay specialist who should be able to help you. In fact, I think he might be on his way now.
Lorenzo!
Thank you for tuning in to The Young and the Breathless.